Our topic today is facial spaces of the hand. We mainly have three facial spaces in the hand, which includes first one being the first one is the palmar spaces. It includes three more, which includes first one is the pulse space, second one is the mid palmar space, and third one is the thenar space. The second one is called the dorsal spaces. There are two dorsal spaces, which include dorsal subcutaneous space. One is dorsal subcutaneous space, and the other one is dorsal subaponeurotic space. The names are given accordingly. Dorsal subaponeurotic space, and the third and the main one is the forearm space of Parona. Is forearm space of Parona. So the first one is the pulse space. So the one you're seeing here is a finger, and this is the middle phalanx, and this is the distal phalanx. And here you have this fibrous septa. These are called fibrous septa, as you know. So at the tip of the fingers and thumb, you have a thick pad of fat which is divided into compartments by these fibrous septa. And because of this spaces are formed, and this is what is called pulse space that we are talking about now. And infection in any of these spaces is called Whitlow. Whitlow is the infection name, and it can be drained. It can be drained by giving a lateral incision which opens all the spaces, and the fluid can be drained, or the infection can be treated. So this is the pulse space, and the artery that supplies here is called the basilar artery. It supplies all the spaces here. This is nothing but basilar artery, and if the Whitlow is neglected, and it can infect and cause necrosis of the distal 4/5 of the finger, whereas the proximal for 1/5 is safe because it is supplied by another artery. Next we have mid palmar space and thenar space. Let's learn about them as differences. That is, mid palmar space is one, and next one is the thenar space. Both are triangular. So coming to the extent, mid palmar space it extends from distal margin of the flexor retinaculum to the distal palmar grease, whereas thenar space it extends from same distal margin of the flexor retinaculum to the proximal palmar grease. Okay, this is distal palmar grease and this is proximal palmar grease. Communications, both communicate with the space of Parona, same space of Parona. And in case if they are infected, where can be drained is. The drainage for mid palmar space is done by the incision in either side of the third or fourth wet space. Whereas for thenar space, if it is infected, it can be drained by the giving incision in the first wet space itself. That too posteriorly have to give the incision to drain. Next you have dorsal spaces. These are two spaces, right? One is dorsal subcutaneous and another one is dorsal subaponeurotic. This one is dorsal subaponeurotic. They given the names because of reason. It lies immediately after the skin, after the loose skin. So that is why it was called subcutaneous. And subaponeurotic, it lies beneath the tendons of extensors and metacarpal bones, which form the thin aponeurotic sheath. That is why it is called subaponeurotic space. That's all about dorsal spaces. Here comes our important one, that is called forearm space of Parona. This one here is a rectangular space. It is present deep to the forearm, just above the wrist, you can say. What we have just above the wrist, you have pronator quadratus muscle. So in front of the pronator quadratus muscle, and just above the wrist, you have this forearm space of Parona. Superiorly, it extends up to the oblique origin of flexor discorum superficialis, and inferiorly, it extends up to the flexor retinaculum, where it communicates with the mid palmar space and thenar space. It communicates. And finally, the proximal part of flexor synovial sheath protrudes into the forearm space. Next, coming to the infection, clinical significance we have, right? If the forearm, this space may be infected to the infection, which are in relation to the synovial sheaths like bursas. What bursa we have there? We have ulnar bursa near it. If the ulnar bursa get infected, the infection is spread to the forearm of Parona. It can be drained by giving a lateral incision. So that's all about the spaces.